You think you hired a contractor, but the IRS, your state board, and your malpractice carrier think you hired an employee. And now you're on the hook for taxes, penalties, and maybe even a lawsuit. In this episode, I'll show you the legal test that decides it all, the biggest red flags and how clinics use 1099s, and how to protect yourself with clean documents and better systems. Stick around till the end, and I'll give you a contractor compliance checklist that you can use today. So way before I was an attorney, I was actually working at a farm. It was my first job. I worked at an apple farm, and I didn't know anything about contractors or employees. I just assumed there was one type, employees. And it wasn't until much later when I started my own business that I found out about this cool thing called independent contractors. And I thought, whoa, cool. Everyone should be a contractor. It's easy. I give them money, they pay their own taxes, and it's very easy to set up. I don't need all this payroll and all this tax stuff. Lo and behold, fast forward, and I created the David Holt Show, which you can like and subscribe to. I found out that pretty much everyone's journey starts this way too. They think that 1099s, they find out about them when they start a business. They think it's the bee's knees. They just say, everyone's going to be a contractor. I'm just going to have them sign an independent contractor agreement, and life is good. But the issue is that misclassification, especially over the last decade, has become a bigger issue at both the state and the federal level. And so most clinics will turn to 1099s just because it's easy, right? It backfires when you have a lot of 1099s and you never did the analysis to decide and analyze, is this actually an employee, and is this a contractor? And remember, again, it does not matter necessarily what you put in a contract. The government can actually overrule that classification. That's one of the myths that I see, is that just because both the employer and the contractor want to be an independent contractor, including the independent contractor themselves, they don't have any issue with it. That does not matter in the eyes of the government. There's a myth that if both of them really want to be a contractor, then the government has to stay out of it. Not true. They still get to come in and potentially reclassify. The financial risk of getting this wrong, if you label someone as a contractor, but they were supposed to be an employee, is that not only will you be responsible for all of the back taxes that you should have been paying that entire time, you're also potentially liable for fines on top of that, which can be substantial if you've been doing this for years, or if you're up to, let's just say 10, 20, or I've seen even 100 staff that were misclassified, and the taxes alone were something that we absolutely did not calculate for, and that could sink a business. And so what states use is what's called a multi-factor test. And the bottom line is that you need to understand what the rules and the factors are. And just because you have a written agreement that says 1099 or contractor isn't by itself going to be enough to serve as a defense. So what actually decides whether someone's a contractor or not? Let's walk through the legal test. It's what's called a multi-factor test, which means it's a fluid set of factors that then you, as the business owner, as the one employing the staff and deciding whether they're employee or contractor, have to have some sort of argument as to how you're passing most of the factors. What's really interesting is you don't need to have all of the factors and be perfect on every single one, but generally there are ones that are weighted a little bit more than others that we always want to hit, and we want the majority at least of the factors to be satisfied. What makes this additionally confusing is that there's state and federal factors. So I'm going to talk at a high level about some of the factors. One of them is what's called behavioral control. So that's going to be something like the schedules and the protocols and how much oversight you're doing. In terms of schedules, do you allow your nurse practitioner, for example, to go and work somewhere else? Or do you say, listen, you need to work Monday through Friday, 9 a.m. to 5 p.m., even if you don't really have patients during that time? I'm exerting behavioral control over you. The second thing would be the protocols, right? So if I, as the employer, is saying what protocols you need to follow as the worker, that's generally suggestive of an employment relationship. You're telling them what to do. Whereas if they come up with their own protocols, they're already pre-trained on how to do a procedure, they already have their own protocol as an independent contractor, that's suggesting that we're not exerting much behavioral control. And finally, very similarly to that is oversight, okay? Are you supervising them, right? Is this a medical staff member that requires supervision? And that is so intricate or intertwined into the relationship that without that supervision, they couldn't do what they need to do. If that's required and we're actually, overseeing and really telling them, hey, you didn't do that procedure right, that oversight is suggesting behavioral control that is more likely to be an employee. So that's one of them. Let's go on to another one, financial control. So who's actually buys the medical equipment? Who's actually setting the rates for the medical procedures? And who's actually taking on the risk if a patient comes out of the blue and says, hey, you did something wrong? So if that's always on the employer or the business, that's going to be more of an employer-employee relationship. If it's back on the independent contractor, so I show up to my job, but I have my own medical supplies. I have my own needles. I have my own gloves. I wear my own uniform. I clean it. I get rid of the needles. I do all of that. I actually set my own rates. And then through a legal contractual independent contractor agreement, I might split that money with my employer, but I'm actually setting the rates for the procedures. And finally, I, as the independent contractor, am going out and getting my own medical malpractice policy. So if I do something wrong, I'm the one that takes the risk, not necessarily the employer. And these are confusing, but they're things that need to be thought about when you're thinking about the multi-factor tests. Finally, we're going to talk about the importance of the intent of the relationship, the actual written contracts, and did you actually follow what the contracts say? So almost always when a client approaches me, I had one last week that said, well, listen, I have a written agreement. It says we're independent contractors. We've mainly followed it, and therefore shouldn't we be good? And by the way, the contractor doesn't even want to deal with the Department of Labor. And I say, well, too bad for starters on the Department of Labor, but also outside of the four corners of that contract, what are you doing day to day? Can she actually pick her own schedule? No, she can't. Did you do all the training for her? Yes, we did. Does she use your computer, your malpractice insurance, your software? Yes, yes, yes. Okay. Now you're failing a lot of the factors of the multi-factor tests. So, and it actually went against one of the provisions in your written contract. So that's what we mean when we're talking about the last control factor or factors is the intent, the contracts, and the follow-through. These are all actually graded together, which is why this gets so confusing. It's not very black and white. It's why there's areas of gray, and actually understanding this is how you can be successful and actually scale up your business by using labor law the smart way. Now that you know the tests, let's look at the smart way to apply it in a healthcare setting. The smartest clinics I know do three things. They define the role, they write airtight contracts, and they stay out of the day-to-day. If you're not able to stay out of the day-to-day, you're not going to be able to scale and grow as a business. You need to be able to smartly leverage your labor force, whether it be employees or contractors, when you're a business owner, to be able to grow the business. You need to be working on the business, not in the business. And to be able to do that, you need to approach your labor law from a smart perspective. So let's talk about the contract clauses that actually matter. So in an independent contractor agreement, not only is there going to be a nice big clause that says this is an independent contractor, but there's going to be sub clauses that specifically address some of the factors at the state and federal level and how we actually interpret those. So we tell the independent contractor what they can and can't do in terms of scheduling, in terms of whether they can work somewhere else, and how they're actually going to behave in a day-to-day operations. Are they going to bring their own materials? We're just going to address those right out of the gate. Not everyone has those clauses in their independent contractor agreements, and that's where they get caught. Because my assumption is that your first line of defense would be a well-written independent contractor agreement that you actually follow. The other thing I want you to do is avoid employee behavior in your management style. It's very easy to think because, like my first job at the apple orchard, you just learn that this is how employers and employees act. You just assume that it's the same for an independent contractor, and it's not. You need to think of them as more so a hired gun, like a gig worker. Their own separate business is often what I use to say, hey, listen, this isn't a business to employee agreement. This is a business to business agreement. It just so happens that the business is one person. That's going to be the way that I need you to think about these and avoid employee behavior that's probably been ingrained inside you ever since your first job, likely as a W-2 employee. So as per usual, I have the systems that can help maintain the legal separation without chaos. It's checklists. It's just clearly going through and determining from the get-go, when are they an employee? When are they a contractor? When are we in between? And what's our actual defense? Going check by check by check and checking it out just like a 100-point inspection on a car. We're trying to pass as many of those factors as possible so we can just hand our assignment to the government if we walked over to the mailbox and there was the U.S. Department of Labor notice sitting there in the mailbox. And if you think 1099s are confusing, wait till you get into aesthetic care. That's where the rules go gray fast. In the next episode, we're diving into med spas, the rules around injectables, cash services, and why aesthetics is one of the riskiest corners of healthcare. You do not want to miss this one.